Hello, everyone. Thank you so much for joining us today. I'm Kevin Morrison. I'm the Cook County Commissioner for the 15th District, representing the Northwest Suburbs. I want to welcome and thank everyone who is joining and watching live today, or maybe watching the recording of this video. This is my third town hall, and today I am going to be joined by some incredible community partners to talk about a very important topic: mental health. We are living through an unprecedented moment in history, and there's no doubt that the collective trauma is causing widespread anxiety and stress. I want my constituents to know that not only is it okay to not be okay, but also that they are not alone and there are resources that can help. I'm hosting this town hall as a reminder that we all need to be kind to ourselves right now and prioritize our own mental health and well-being. And I hope that those who are tuning in come away with some guidance and resources on what to do if they or a family member needs help. I have a great group of people joining me today, community partners from across the Northwest Suburbs and the state of Illinois. And first, I want to introduce our star guests. Today, we're going to have Lauren Saternus, the chair of the Schaumburg Township's Mental Health Committee. We have Linda Springer, Senior Director of Clinical Behavioral Health Services at Kenneth Young Center, and Andy Wade, the Executive Director of NAMI, Illinois. NAMI is the National Alliance on Mental Illness. And without further ado, I want to get to this incredibly important conversation. So first off, we're going to have Andy from NAMI, Illinois joining us. Thank you so much for being here with us today, Andy.
Okay, well, thank you for having us. Yeah, it's really important and exciting to be able to gather in whatever way that we can during these times to talk about some of these issues. NAMI is, you mentioned, is the National Alliance on Mental Illness. We're a national community of family members, loved ones, and individuals who have lived experience dealing with mental health issues. So we're you and me, we're the public. The NAMI Illinois is the statewide organization of the NAMI chapters. There's 20 different local chapters, including one in the Northwest Suburbs that I'll have that information for. And we are essentially trained volunteers who have some background in this from our own lived experience. And our mission of all NAMIs, whether it's national or local or state, is to advocate, educate, and provide support on issues related to mental illness. So with advocacy, especially during times like these, we are advocating in Springfield and in Washington to make sure that resources are going where they're needed, because in these times, many more people need support than ever before, not just people who've already knew they were struggling. This is everyone right now. So we advocate quite a bit. The education, this is Mental Health Awareness Month. The theme of our campaign is You're Not Alone. This is about understanding and stigma. Stigma is not just being mean to people who have mental health issues. This is dangerous. If people are unable or unwilling to speak up about their health problems, it's hard to get better. You know, if you have a really bad cold, you don't feel that you need to hide that. Unfortunately, with mental health issues, many people still feel that they need to hide that, and that prevents them from getting help. So education and stigma awareness is a big part of our mission. But then the last part is just to provide support. I mean, as Kevin said, this is a time to be kind to ourselves and to each other, but that's not something to always try to do by yourself. So we've moved all of our support groups and as many programs as possible to online, so the Zoom format. We have family support section, peer support groups, and a variety of different things that are coming up because of COVID for how to deal with stress and anxiety. 58% of Americans reported anxiety within 2 weeks of this hitting. So people are really more concerned about mental health issues than the physical issues, and these physical issues are significant. So this is important work. And if you're feeling anxious or afraid or depressed or isolated, well, you're not alone. This is something where the things that we have to do right now to keep ourselves physically healthy are not exactly conducive to good mental health. So if you're feeling depressed, we generally don't want people who are depressed to be alone and isolated, but right now we have to be alone and isolated physically. So, and we don't, if you're feeling anxious, you don't necessarily want to worry about symptoms for something that hasn't shown up, except now we have to. So we're dealing with a situation that by its nature is challenging for all of us. So I find that comforting for myself because it allows me to forgive myself when I'm having problems. So I'm really happy to be here and hope that people do take the step to ask for help if you feel like you need help. This is not something to do alone or be embarrassed. This is just about getting together and supporting each other. That's all I got. Sorry, that's everything.
Thank you. No, of course. No, that's incredible. Thank you so much, Andy. That is incredible advice for this moment. I'm happy to have you here, and thank you. Right now, next up, we're going to have my friend and the chair of Schaumburg Township's Mental Health Committee joining us, Lauren Saternus. Thank you so much for being with us.
Thank you so much for having me, Kevin. I'm really excited for the opportunity to share what Schaumburg Township is doing to support mental health, and specifically how our committee has adjusted our programming over the last couple of months. I want to first give a brief overview of the Mental Health Committee's role in Schaumburg Township. We are a group of volunteers who work to increase mental health awareness in the community, and we primarily do this through events and trainings that are open to the public. We also provide funding recommendations to the Board of Trustees for agencies that provide nonprofit mental health services to our residents. These include Northwest Center Against Sexual Assault, Lifespan, which focuses on advocacy and counseling for victims of domestic violence, the SHARE program, which provides substance abuse treatment, and of course the Kenneth Young Center, which provides a broad range of mental health services. I would like to point out that each of these agencies has shown tremendous responsiveness during the stay-at-home order, and they are continuing to provide services. As an example, the Northwest Center Against Sexual Assault is delivering emergency room advocacy services by phone and provides prevention education to high school students through Zoom. And it is truly amazing to see how quickly these agencies have adjusted when these services are perhaps needed now more than ever. Over the last several years, our committee has traditionally hosted an in-person mental health awareness event called Minds Matter during May. It has been so rewarding to watch this grow over the years, and we were seeing upwards of 100 community members coming together at the Township building in Hoffman Estates to learn from several speakers and around 30 mental health agency representatives. So this year, rather than cancel the event altogether, we decided to move the programming online. And using social media and the internet is something that we've always talked about using more. And this pandemic has really pushed us to spread our wings and get creative about how we can reach members of the public without having the option of a physical event. And I think this phenomenon of being forced into that is probably something that many of us are finding both in our personal and professional lives. So instead of having our 4 speakers present in person, they have graciously recorded themselves, and those videos are posted on the Township website and to our Facebook page. Topics this year include the link between sleep and mental health, the impact of trauma on the brain, how to communicate with someone experiencing a mental health crisis, and what to expect in a police response if you call 911 for someone experiencing a mental health crisis. We are so grateful to our partners, Tiara Grant and Dr. Yajaychak of Amita Health, Dr. James Kowal and Sergeant Matt Christensen from the Schaumburg Police Department for providing their time and expertise in this unique way. During the month of May, we will also be highlighting agencies on our website and Facebook page so that residents can access information that would have otherwise been available at our fair. And finally, we recognize that there are families with no or limited internet access, and in the interest of spreading awareness as far as possible, we are providing over 200 informational resource bags to folks visiting the food pantry. And this was made possible through our partnership with Kenneth Young Center, as well as contributions from a variety of other mental health agencies and foundations, including the American Foundation for Suicide Prevention and the Bridge Youth and Family Services. So while we certainly miss having a bustling township building and bringing agencies and residents and mental health professionals together in a physical space, I am pleased that we have been pushed to find other ways to reach a perhaps broader audience during this time. So thank you for the opportunity to further those efforts here today.
Thank you so very much, Lauren. It's so great to have you with us. I'm very excited about this panel. Now, before we go on to our next panelist, I do want to give a reminder to everyone watching. If you have any questions about resources or for any of our panelists, if you just put those questions into the comments stream on the live video, we can see them and we'll be able to get to your questions when we get to our discussion. Our next panelist, first and foremost, I do want to say, many of you who know my story as a youth, I did experience bullying when I was going through my schooling, and it was actually at Kenneth Young where I was able to go through therapy and deal with some of the trauma I had from my schooling days. So I'm really happy to have Linda Springer here with us today. Linda is the Senior Director of Clinical Behavioral Health Services at the Kenneth Young Center. Thank you so much for being here with us today, Linda.
Thanks, Kevin. I'm happy to join you all. I would like to say that we too are wanting to be supportive to our community, and I welcome the opportunity to tell you a little bit more about Kenneth Young Center. So Kenneth Young Center is a community mental health center. We are celebrating our 50th year this year. We turned 50 in November. Our main location is in Elk Grove Village, but we have 5 additional locations. We have 2 that are in Schaumburg. We have 2 that are in Arlington Heights, and we have 1 that's in Mount Prospect. We have a very broad range of services that we provide here. We have a whole division that deals with prevention services. So they're focused on positive youth development services. They're looking at substance abuse prevention with kids. They're looking at teen pregnancy prevention. We have an LGBTQ plus center that opened up that's been very successful in one of our new offices in Schaumburg. We also, which is a little bit unique to a community mental health center, we also have a large older adult department. The goal of that program is to keep our older adults independent and in their own homes for as long as possible. So we have a wide array of services that can lend to that goal, and they are out today. I came in the parking lot. We have a Meals on Wheels program, which, as you can imagine, with this COVID-19, a lot of seniors are even more stuck in their homes, and so the demand for delivering meals has gone up exponentially since COVID-19. They've been doing a great job. And then we have the behavioral health services, and Kenneth Young has many behavioral health services that really span the age span. So we serve little ones as young as 4 or 5, all the way up to older adults that might be in their 80s and 90s. We have that traditional individual therapy, family therapy, couples counseling, group counseling. We have full psychiatric services. So we have psychiatric services for both adults and for child and adolescents. We have school-based services where the therapists are actually seeing the children in the school. We have mentoring services where the therapists are actually taking those children out into the community and teaching them skills and helping them figure out how to manage out in the real world. We also have parent mentors that are supporting the mentors. So let me pause with that. As you can imagine, all of those services were either in the office or in the school or in the community. So we had to shift rapidly within a week to adjust our services, and we are providing telehealth services. We have several platforms, audio and video. We're just working with what is available to the client, and then we match that up. So we've had fairly good success, but it was an adjustment. It was an adjustment for the therapist to figure out how to do this work, and it was an adjustment for the clients to get used to doing the work in a different way. So back on the bandwagon with our services. So we have mobile crisis response. So that team of workers is dealing with high-risk youth. If someone is in a position where they're concerned about their child and they feel that their child might need to be hospitalized, then our worker will go out and do an assessment on that child. It may be that the safest place for that child is the hospital. Then that child would be admitted and we would follow that child. Sometimes we feel like we can safely deflect the child if we provide care. And so again, maybe we prevent the hospitalization for the child, but then we're following that child and making sure that they have the services to make sure that they're well and safe. Those services, some of the MCR services are still face-to-face. If we need to do that assessment face-to-face, of course we do. Sometimes if they're in the hospital has the equipment where we're able to do the video assessment, which just keeps obviously less people in the ER and keeps the workers safe, keeps the clients safe, but we continue to obviously provide that service. Kenneth Young Center in the last year has gotten our license to provide substance abuse services. So we now provide
Linda, I think you got muted.
I'm so sorry. How about now?
We can hear you.
Okay.
We lost you at talking about the latest switch to be able to deal with people in recovery.
Okay. So the substance abuse services?
Yes, that's where we lost you.
Okay. Sorry about that. Don't know what happened. We got our license to provide substance abuse services at Kenneth Young Center. We've always dealt with people that have had co-occurring disorder, but now we're in a position where we can provide more intensive services for people that are struggling primarily with substance abuse issues. So we have an intensive outpatient program both for adolescents and for adults. All of those services have also gone to telehealth platforms. We have a psychosocial rehab program. So if people are dealing with more chronic persistent mental health, they may be accessing our services here. That's open 5 days a week. Normally we're running 40 groups a week in our psychosocial rehab program. But again, because of COVID, we have had to shift that programming to telehealth and groups online. Using Zoom, having the ability to have someone call in because some people don't have the video capacity, but we're doing all we can to help meet the needs of the clients that are out there. We have case management services. Sometimes people need help just accessing other providers and other care, whether that's benefits or outside providers. So we certainly help people do that. We have a transitional living program. So Kenneth Young has 4 apartments right now with 8 people living there. So these are folks that maybe have never lived independently before, but we are stepping them into independent living for the first time, and they have a lot of support. They're learning skills. Our goal is obviously in about 2 years that they're able to live independently and not in that program. We have a wonderful drop-in center that serves adults. That's open 364 days a year. Anyone that is experiencing any kind of mental health issues is welcome to come. The only day they're closed is Christmas Day. they too have seen a shift, obviously. So they are providing multiple daily groups, and all of that information is on the website. They also are calling people individually to check in. And so if someone is just needing support, that's another way to access the support through Kenneth Young Center. Then we have community support services. So we have a very large group of workers that are dealing with folks that are actually receiving care in the community. So as opposed to the client coming to our office, these services are primarily provided in their home or in the community. So if someone is needing one-on-one support, our therapists are actually going to their apartment and helping them build those skills. It may be that they need even more intensive care. And so we have a community support team, so that one client might have a whole team of workers that's helping them be successful in the community. Recently, probably last fall, we have partnered with the state and are doing what we call front door diversion services. So if a person is in an emergency room and the staff is contemplating putting that person in a long-term care facility, they need to call us. So we're partnering with 12 hospitals. So the hospital would call us, and we would send our worker out, and we would do an assessment and make a determination if this person had the proper supports. Do we feel we could deflect them safely into the community? And we are helping them with all kinds of resources to make sure that that deflection is is successful. That team has also seen a huge surge with COVID-19. As you can imagine, a lot of people are fearful. They don't want to go into a nursing home right now with the pandemic that's happening. And so we are finding that we're helping even more people, trying to deflect them and get them supported and engaged in services in the community. Lastly, but certainly not least, we are very involved with the Comprehensive Transition Program in the state of Illinois. So Kenneth Young Center has been named a prime agency to provide intensive supportive services for people that are actually already in a long-term care facility for mental health reasons and physical reasons, and they want to step out and live in the community. So they're in the nursing home, but they don't want to be in the nursing home. We go in and do that assessment. We're connected with 26 nursing homes, and we are going to assess what needs to happen for them to be able to step out successfully and safely. And then we are providing a plethora of services. We have nurses, we have occupational therapists, we have housing locators, we have benefit specialists. Obviously, we have therapists. Those people that are stepping out into the community often are needing the very highest level of care that Kenneth Young Center provides. Currently, that is our CST services, but we are about to launch an ACT team, which is Assertive Community Treatment Services. And that is a whole group of therapists and doctor services included that are seeing that person multiple times, could even be daily, a week, to assure that the services that they need, they are receiving to be successful in our community. And it's a wonderful thing to watch, because it's sad to see someone who might be 30 and in a nursing home, and in a nursing home for many, many years, when if they have the proper services, we can help them thrive in their recovery in the community. And we've taken great pride in that, and it's brought many smiles to our faces because we've had a lot of successes. So we continue to grow. So Kenneth Young Center provides lots of services. We have had to, like I said, adapt in many ways. We also partnered with the state for the Calm for Calm, and I think we might be able to put it up for you. That's actually, thank you. That's a text number. You can just text. And if you're needing emotional support, if you're needing access to resources, we will get back to you within 24 hours and talk with you, connect you with resources, open you as a client if you're wanting to come to Kenneth Young Center. So we are here to support everyone every day of the year, but even more so now with the unprecedented things that are happening. So if we can be helpful, please call.
Amazing. Thank you so very much, Linda. And thank you to everyone who's joining us on our panel today. We are blessed here in the Northwest suburbs and around Illinois to have advocates and programs available to a wide range of needs. And so we're lucky to have you all. First and foremost, Little Bird just told me that as Kenneth Young turns 50, it's also going to be Linda's birthday. So happy birthday to you.
Oh, thank you. Thank you.
One of the programs that you mentioned was at Kenneth Young, providing seniors with meals. It's a great program. I've helped, for example, Hanover Township deliver meals for seniors during this time. We did get one question. At what age are you considered a senior at Kenneth Young?
So you know what, I'm going to text by the end of this call. I'm going to confirm that, but I want to say that it is 60. But let me double check, okay?
Thank you so much, Linda. I appreciate it. I know all three of you kind of touched on this, but any of you could jump in. I know Andy has been doing some great work about transitioning to services in this new world that we're living. So as service providers have been shifting how they support their clients, what alternative treatments have shown the most promise?
Okay. Well, I can talk about what NAMI Illinois is doing and our chapters are doing. We are a group of, we're not trained clinicians, but our programs are evidence-based and people go through, training. So NAMI programs are quality, and generally in situations where there does need to be a clinical partner, we bring that in. So most of our work is on Zoom these days. If you go to www.namiillinois.org, there's a place where you can click on a map, find my affiliate. There's a local affiliate. You can also click on the sign up for support group scroll, and that'll have a schedule of all the different support groups and programs. Because we're chapter based and sort of diverse and mostly volunteer, we don't have a master schedule yet. So you can also check around to your local chapters, but there are support groups that are led by facilitators who are people like you and me who've been through it. And so NAMI, I think the way to think of those sessions is NAMI is, the caring friend who understands, who has some knowledge. And so those are happening mostly in the evening. You can click a link and sign up. And everything we do is free. I do want to make sure that people also understand that, a support group and conversations and all of those things that are about staying well mentally, that's not the same as sometimes when you might get to the point of needing professional support. That's something to be mindful of those differences. So I think, all of the resources here, there's just a lot of resources that are out there for you. So one thing I know I've seen a lot is people started out in the pandemic with a plan. I'm going to make the best of it. And I know I hit my wall about, 1 week in, then I hit my other wall about 3 weeks in. and this is an up and down situation. A thing I think people need to keep in mind as they're dealing with this or dealing with their families is, if things go on for a while, we all get depressed, but depression is when you have this for quite some time. And so I know I've seen with people that are in my life, things that were sort of episodic as they began to go on for a while, to me, that was a cue that there's something bigger going on that I can help with. And so that's a time to get help. So this is something where it's being mindful about what we're thinking and feeling, because when you're not feeling well mentally or emotionally, very few diseases have the instinctual desire to hide themselves. But if you think about it, anybody who's ever gone through depression or anxiety will understand this. You try not to show that to the world, and that can be dangerous if that goes on for a long time. So if someone is down in the dumps, not willing to get out of bed for a week, 2 weeks, that's the time to ask for more help than you can get. So on our website and on this scroll, all of the prevention numbers. Call for calm is excellent. You don't have to be in crisis. This is, I need someone to talk to. I want someone to talk to. You don't have to wait till you're in crisis. There's also crisis lines. People will know what to do. What's nice about Call for Calm is, while it's a statewide number, that channels to someone who knows your community. So they know, it's probably Kenneth Young, or, they know who exactly can help you. So it's hard to be embarrassed about how you feel, but we all deal with that, and this is something, it takes some courage, but taking action can also make you feel better right there. So just don't hesitate. That's what I got.
Oh, thank you so much, Andy. Did Lauren or Linda, did you want to add anything?
Okay. I have the answer, so I just okay. But yes, it is 60. So for the Meals on Wheels, I think was the question. But it can also be somebody that is an adult with a disability. And one last thing, the caregiver can be younger and receive a meal as well. So just wanted to check my answer there.
And very helpful. Thank you so much for sharing that, and we'll make sure to get that posted too. Now, I do want to remind anyone who's tuned in as we've been going through this conversation, if you have any questions that you would like answered, please place them in the comments, and we'll be happy to get to them. If you're watching this recorded video and have any questions, please put those in the comment stream, and we'll make sure to get you an answer down the road. Now, as I go into the next question, I just wanted to share a little bit as well. Even prior to getting into our COVID world, I was of the strong belief that we all need someone to talk to. And I know that there is a lot of fear and shame that sometimes falls on a person to be able to take those steps to get help. But I want to tell you, we all need help at different times, and there's nothing shameful about it at all. Actually, taking those steps are a sign of strength. I've had therapy, and I am better off for the information and the knowledge I was able to gain through that experience. And I think it can be helpful to anyone, no matter what situation you are in. So I know we've talked about the text line, but if anything you want to add, if someone is new to seeking help with their mental health, what's an easy first step for them? Are there a few self-care suggestions you can give for everyone to implement during their time at home? For me, for example, what I do to keep happy right now is cooking and cleaning. That's what gets my mind off of COVID. So if you, any of you, if you would like to share any.
I know a lot of what we've seen as a lay organization is, I think people do feel maybe they're less intimidated talking to other people who've gone through it, but people who never before thought of themselves as mentally ill or having this are suddenly experiencing this, and so it takes a lot of the courage to ask for help is a big part of it. If someone's suffering in your family around, you may have to be a little persistent about reminding them that it's okay, because we do tend to not want to expose ourselves. But just some things that we do to take care of ourselves. One is, right now, managing your media intake and the news. There's one story right now, and we'll get back to normal, and all of the other stories in life do continue to go on, but it's coming with this lens that it can be a little much. So one thing you can do is turn off your screen and give yourself a break. So managing that and being mindful of that, monitoring your young people, your children on that is important. The other thing I think is, healthy routines. And that's something that as it goes on, it's easy to see that slipping. I have my list of things that I was going to do. I was going to be all muscular and healthy and everything, but I'm getting by. But I am trying to maintain a world-like routine. So that kind of healthy routine and taking care of yourself as part of that is really important, especially in encouraging your children to do that. Self-care is obviously, physical health and mental health are very closely connected. Anyone who's ever, told you about a runner's high. I mean, this is something where physical exercise is one sort of go-to easy treatment. You want an easy step? That's step one, to feel a little better. And it can also, when you feel a little better, it can help you be willing to deal with those things that are bigger than just going for a run to take care of. So that the other piece I wanted to say is, taking some time to connect with other people. We're hearing that a lot. I mean, I myself was skeptical about this. To be honest with you, I love seeing people's faces right now. So connecting with old friends, it's been wonderful to connect with some people I haven't heard from in a while. We know we're all struggling. So the other thing is, I know that, and it sounds like Kevin, this probably helped you, is that if you are struggling, sometimes finding a way to be of service to others can be very powerful. I'm blessed to have a job where I get to, tell what I know, which isn't much, but helping other people can also take your mind off your own things. So being of service, I think, is something to keep in mind.
No, that's incredibly helpful. Amazing. Linda, would you like any to add to that?
So many of the things that Andy said, I agree with. One of the things that strikes me at this time, it feels very familiar to me in terms of when we went through 911 and 9/11. I had clients that were constantly watching TV, and the stream of, obviously we saw the buildings go down. There was so much trauma, and they just didn't give themselves a break from it. So I very much agree with Andy that one of the things that you can pretty safely assume is that if you check in the morning and watch, 30 minutes of news, and then if you want to watch 30 minutes of news in the evening, you're going to have it covered, and probably not even that long. And so really to limit the amount of media barraging that we're, experiencing is very helpful. So a lot of the things that Andy said, keeping a schedule. I'm having a lot of people that are struggling with their sleep schedules getting mixed up because they're staying up later and then they're getting up later. And then, if you don't have to get up for work, it's just very challenging. So even if you can try and just set your alarm and get up at the same time and eat at the same time and go to bed at the same time, trying to help people focus on what they do have control of right now, because there's an awful lot that we don't have control of. Right. So having a sense of mastery can be very helpful during these times. Self-care is very individual. For someone, they might go on a run and that might feel like self-care, and that would not be what I do for self-care. But people are loving their pets right now. And they're going for walks, and I think dogs are loving it, and cats are like, why are you still here? But, just trying to reach out. And, I know for us, one of the things that we did, we have good neighbors that live across the street. So we literally set our lawn chairs up on the curb, and we were across the street. The only one that had contact was the dog because he was going back and forth. But just trying to be creative. And summer's coming, and being active and getting some fresh air, all of those things that Andy mentioned, I wholeheartedly agree with.
Oh my God. No, that's great advice. I tell you, at least for me personally, I'm not someone who usually was allowed to be home during the times where you'd usually cook a meal. and being able to eat healthy
Right.
foods right now has given me so much more energy than I had before when I was having to rely on takeout so often. So that's been a good shift for me personally. Now I want to move on to Lauren, and also maybe you could help expand on this. What advice do you have for parents who are worried or want to check in on the mental health of their kids as they stay at home?
So I would echo a lot of the things that Andy and Linda have spoken to. I would also say that the CDC has published some helpful tips for maintaining mental health. The only one that I didn't hear, I think, was taking a deep breath and just really utilizing coping skills, whether that's through meditation or some other means. I would also point folks to our website, schaumburgtownship.org, and you'll find our speakers there, and one of them speaks specifically about sleep. In terms of advice, I'm not really in a position in this role to offer mental health advice, but I would defer back to Linda or Andy on that.
Thank you so much for that. Linda, do you have any advice for the parents out there who are worried about how they could communicate with their children right now about their mental health state?
Well, I think obviously one of the things you want to do is not assume that they're okay, and check in often and ask how they're doing. I think it's probably going to be different depending on the age of the child. So if you have a little one, they may open up to you and talk to mom and dad about how they're feeling. If you have a teenager, they might not want to talk to you, and it has nothing to do with the pandemic. It's just where they are developmentally. So if you can encourage them to, obviously invite them to talk to you about it. But if they're talking to any adult, then that's a good thing. And I also think that if you invite your child, if you see that they're struggling, and ask them, do you feel like it might be helpful if you talk to someone that wasn't mom and dad, that's objective, that could be there for you and be your person that you could talk with? And parents might be surprised, because a lot of times the children will say yes to that. And then, of course, I would encourage them to call and get that process started to get that child connected. Another thing I was thinking is that there's a lot of things right now in the world that are making folks anxious. They've lost their job, they're worried about losing their job, they're worried about their health. Children are extraordinarily perceptive. And so a lot of times when I have an anxious mama, I'm going to have an anxious little one. And so it's really just being aware. If you're having a conversation with your spouse about, how are we going to pay the bills? Don't have that conversation in front of your 10 or 11-year-old. I mean, I think the kids need to have that clear, consistent message that mom and dad are in control, and we're going to make it through, and everything's going to be okay. And you don't have to worry about it, because that's our job. We're going to worry about that. But sometimes, people just aren't cognizant of where they're having those conversations, and kids pick it up and really carry that with them, and they're very frightened. So, just awareness about when you're having those conversations, where you're having those conversations, and then how you talk to your kids about things.
Oh, that's incredible. And I do have another question for you, Linda. It's an important topic that I'm sure a lot of people have been hearing about in recent days as we've been sheltering in place. Unfortunately, domestic violence has been on the rise. It's not always easy to reach out for assistance with fear that you might be overheard. I know that there are text helplines. I know that groups like Wings are doing a great amount of work right now to help find safe housing for those who are most in need. How is Kenneth Young been stepping up to help deal with the domestic violence population right now?
Well, certainly we, Kenneth Young Center, typically, if they're needing those specialized resources, then we, would be referring to those agencies that you just mentioned that specialize in that have those services set up. We would link them here's what you need to do, here's who you need to call. They're going to walk you through that process. It's challenging on many levels, people being stuck in a home, and domestic violence is definitely one of those things that we might unfortunately be seeing a spike in.
And there's text hotlines as well for people to reach out, and there are a lot of resources on that front as well at this time. It's so great to have all of you panelists here with us today. I want to see if you have any last words of advice to share. I think maybe we may have gotten one last comment. Let's see. What effect do you think the lack of physical contact with others will have on people? I'm a hugger. Oh, I hear you. I hear you out there. I'm a hugger as well. I'm Italian. It's been so difficult. Oh my God. Would anyone want to jump in and help answer that question?
It's hard for me. I'm fortunate when my children are young enough that they'll be okay if I give them a hug. But even then, we're all being mindful of it. And so things like pets and, other opportunities to have physical touch are those are useful. I think a thing that I know we just have to accept, we have to accept this is what we do, that what we can do is the best we can do. And that's okay. It's not ideal. We have to talk ourselves into it sometimes, to say, I'm having a good time meeting people face to face. And it's not the same. It's not the same. And I think, I know sometimes when I've gone through depression, I don't want to show that, but not only that, I feel bad about having depression because I've got my kids and I shouldn't feel that way. Well, you know what? It's okay to feel how you feel. And missing physical touch is something I think we're all experiencing. So I wish there was a good answer for that, but I don't have much more than that. Maybe Linda and
before I let you all continue, we got a great comment. Someone posted, I'm a hugger too. We need to learn how to hug with our words. I think that's beautiful.
I love that. That's so nice. Yeah.
That's very nice. Yeah. I think that, for people to keep it in perspective, and if you can say, this is temporary, this is hard, but this is temporary. And when it's all over, we'll have a hug fest.
I agree. I've had a couple times where I've, of course, social distancing with my mom, and I'm very, very incredibly close with all my family members. Like I said, we're Italian. And when I see my mom, she almost cries because she wants to give me a hug. I haven't hugged her in over 2 months.
Yeah.
And, I'm trying to protect her and vice versa, but it is difficult. And just being able to talk to your loved ones right now and tell them that you love them, to do FaceTime, to have conversations over the phone, to, I've driven over by my grandparents and waved and talked to them through the window. Just any way that you can make that connection and interact with them, even though you cannot have that physical touch, it does make you feel a lot better. Awesome. Do you have any last words that you guys want to add today?
I just wanted to say that you really don't have to, suffer. You don't have to be alone in this process. And, I've had people that, when I call them for their appointments, they will say to me, I've been waiting on the phone all day for you to call. And it's something to look forward to. It's another person to connect with. And we are there for you. Kenneth Young Center's line is Together We Thrive, and together we will thrive. And so if you are needing help, please reach out, because that's our mission. That's why we're here.
Amazing. Lauren, any last words from you?
I would totally agree. And I would also say, even if you don't feel that your mental health needs are severe, not to minimize that and not to wait, but to go ahead and reach out. You deserve, the help and support as well, even if you're feeling as though your needs are not as significant as some others might be.
Amazing. No, it has been an honor to have you three with us today. I think this was an incredibly important conversation. I hope for all of our viewers that you were able to get some helpful information and resources that are becoming available. Something Andy said earlier really struck me, and it's been something I've been enjoying doing over the past several months. There's a lot of volunteer opportunities and ways to give back right now, and you really feel fulfilled and good in doing that. I was delivering meals to seniors in Hanover Township. I was packing foods and essentials for veterans. After doing things like that, you feel great. And right now there is a major shortage of blood donations as well. And so if you are able, the Red Cross needs blood donations. So there are so many ways to give back at this time. There are so many resources out there to get the help that you need if you are struggling in this moment. I hope that you recognize that there is strength in asking for help. It is not something bad. It is something that is empowering, and it actually shows a great amount of strength to do. And I've done it myself, and I hope that if you are needing help or a loved one is there that needs some help as well, that you help share these resources with them. Thank you all for taking part in this. It was great having you with us this afternoon. Thank you.
Thanks, Scott.